My name is Stephen Kennedy, and I'm the Program Director for the University of Washington Orthopedic Surgery Program. I came here as faculty in 2013, and I have been involved in the residency program ever since then, and I became the Program Director in September of 2022. I came here as a trainee myself, as a fellow in 2011 to our hand surgery program, and I'm a hand surgery faculty member at two locations at the University of Washington. One at UW Medical Center Northwest Campus, which is a former community hospital, and Harborview Medical Center, which is our level 1 trauma center. Thank you for your interest in the Orthopedic Surgery Residency Program at the University of Washington. I would like to start by congratulating you for the tremendous work and dedication that you have shown to get to this stage. Our faculty has thoroughly reviewed every one of your applications, and I have personally reviewed every one of your applications through a holistic review process that has considered every aspect of your application. And I'd like to tell you that you're in the top 10% of all of those considered applications. We really look forward to interviewing you and getting to know you better. There are many reasons why I love UW, but I think I could boil them down to 4 main reasons. The first one is the camaraderie. I actually had an entirely different career plan for myself until I interviewed at the University of Washington, and I immediately recognized the camaraderie among our faculty and our residents, and I realized that this is someplace that I wanted to be. And through that interview process, I came here as a hand fellow in 2011. And that brings me to my second comment, which is the case complexity. The University of Washington is a tertiary referral center for about a quarter of the landmass of the United States and 12 million people. That means that we get some of the most complex patients in this entire region with incredibly difficult problems, and oftentimes our patients are our best teachers. The third thing that I think really was important to me is that the University of Washington hospitals, not just at Harborview, but at all of our hospitals, have a mission of service. We care about underserved populations. We recognize the social determinants of health, and we want to make sure that every person, regardless of their ability to pay, gets the best possible care that they can. And that brings me to my fourth thing that I love about the University of Washington. And this happened within just a short time of being here. Probably within about 1 month, it became very apparent to me that faculty members and residents were spending additional hours, going the extra mile, doing difficult things to make sure that we got the best possible outcome for our patients. And I think that it could be encapsulated by saying that we do the right thing for the patient even when it's hard. And I think with that culture, that is something that if you come here and spend 5 years training with us, that you'll bring that with you into your career going forward. If you choose us for your residency program, I feel confident that you will have the training that you need to do any subspecialty or any type of practice that you choose for your career. This could be academic practice, it could be private practice, and it could be in any one of our subspecialties. We have tremendous feedback from fellowships across the country and beyond regarding our residents and the training that they receive here and their abilities and their professionalism. And there is no denying that our program is challenging. There are difficult times, but we feel that you will gain great knowledge and abilities from this training, and it will put you in the best possible position to get the best fellowships and the best career positions when you finish your residency. One of our greatest strengths is our world-class faculty. If you take a cursory look at our faculty members, you will see a lot of names that are editors of textbooks, authors of book chapters, authors of publications, and are present at many of our subspecialty societies and also our orthopedic general societies as leaders of instructional course lectures in large auditoriums. Many other surgeons will spend a lot of time and money to come and listen to our faculty speak about various topics. But I think the best possible way to see how a surgeon does things in real life is to actually spend time with them in the operating room and in the clinic to see how they achieve the special results that you see in publications and in textbooks. And so I think this is a remarkable opportunity for you to be involved in that process. In this program, we take great pride in the collaboration between the residents and the faculty in terms of patient care, but we also take similar pride in the collaboration between residents and faculties in terms of scholarly activity, including research publications, presentations, and technical video demonstrations. And this creates a special relationship between our residents and faculty that allows the residents to not only support what the faculty are doing in terms of their academic productivity, but it also puts you as a resident in the best possible position to get some recognition early in your career and to create a new path forward for yourselves as you complete residency and go on to the next stage of fellowship and a possible academic career. The camaraderie that you will find in this residency program is not just limited to the time that you're here as a resident. It is once you join this residency program, you're joining a program that will continue to support you for the rest of your career. I frequently get emails, text messages, phone calls from our residents after they graduate with questions, and I'm so happy to be able to support them in that process. I have done review sessions with former residents in order to help them with their preparation for their board certification and recertification, and I am also excited whenever we have alumni return to participate in our alumni events and hearing how they are doing in their careers and with their families. And so the term is often used lightly, but we really are a family, and we look forward to seeing the success in your career, whatever you decide to do at the next stage after you finish our residency program. One of the things that makes our program unique is our sites of service. We have a distributed program at multiple different hospital sites, and so you get the strengths of each of those sites to support you in your residency education. We have Harborview Medical Center as our level 1 trauma center. We have UW Medical Center Montlake campus as our university hospital with many complex patients that are tertiary or even quaternary level care. We also have UW Medical Center Northwest campus, which is a former private community hospital that has joined the University of Washington. And so you get a different flavor of more typical community orthopedics at that location. We also have our state-of-the-art Husky Stadium Sports Medicine Clinic, where we take care of the Husky athletes as well as athletes of all different levels across Seattle and the region. And we also have Seattle Children's Hospital, which takes care of some of the most complex problems for children across the region, also regardless of their ability to pay. We also have an excellent opportunity at our VA hospital, which is highly rated by our residents. It's an excellent opportunity for graduated autonomy as you go through the residency, because we have multiple rotations there throughout residency. It's also a great opportunity to better understand the special needs of our veteran population. The other thing I love about Seattle is that when we're not in the hospital or studying, there's so many opportunities outside of the hospital for anyone to do. We have all of the same arts opportunities of any large city, but we also have an incredible natural beauty that surrounds us. This includes the Pacific Ocean with the Puget Sound inlet, as well as lakes. You can't drive through Seattle without passing a body of water like Lake Washington or Lake Union. And we have mountains for hiking in the summer and skiing in the winter. And so, whatever interests you, we have it for you in Seattle. So, what about next steps? We are going to we look forward to meeting with you at the interview process. This is going to involve not only us interviewing you, but you also interviewing us. There's going to be opportunities for you to meet with our existing residents off the record to get all of your questions answered. And if there are other things that we can do to help answer any questions that you have, please reach out. We believe strongly in the importance of the code of conduct of the match, and we will be following that. If you think that there is anything happening that strays from that, please let me know. And also understand that we are not going to be doing a lot of communication after the interviews, including written or other communications. We are not going to be having secondary interviews. There will not be any in-person interviews. So the best opportunity for you to communicate any personal message that you have is going to be directly to faculty members and residents through the interview process. I hope that you get all of your questions answered and that you find us to be the right fit. But most importantly, I hope that you find the right fit for you wherever that might be, and that you have the best possible success in your residency training program. I would like to thank you again for the time and interest that you have taken with the University of Washington and for watching this video. I very much look forward to getting to know you better and to sharing with you what we have for you to offer. And I sincerely hope that you are able to get the information that you need to make the best possible decision for you and for your career. Thank you.